Good afternoon.
Hi, good afternoon. I'm Elizabeth Smith. I'm the chairman for the CARES Act Steering Committee, and I'm coming to you from the conference room of the governor's office. And with me today, I have Dr. Greg Bledsoe, the co-chair of the committee, and then we also have Representative Allen and Representative Gray in the room, and also Bill Gossage from the governor's office. I think we have everybody on the line. The one
This conference is being recorded. Only the main conference is recorded.
Very good. So our conference is being recorded, and we are live streaming through YouTube. Is that right? Oh, that's okay. I just want to make sure we were okay.
We're good.
We are live streaming through YouTube, and I think Representative Jean is going to be calling in from the phone, and I don't know if we've gotten him on the line yet, but otherwise everyone else is here, and I'll just make a note that we'll be watching out for him. So I just wanted to start by calling our meeting to order. Glad everybody's here. We are missing the governor today. He's in Washington, D.C., but we will be reporting our information to him as soon as he's available to hear our report. I did send out the minutes, and I wanted to see if anybody had an opportunity to review those, or if y'all wanted a chance to review them now, or any questions, changes, or a motion to approve of the minutes from the last meeting, which was on May 13th.
I would move we accept them as mail.
Thank you
email.
very much.
Second.
Motion and a second. I've got a motion by Gossage and a second by Representative Allen. Thank you. All those in favor, please.
Aye.
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 Thank you. Anyone opposed? Thank you. Any opposed? Okay, we have accepted the minutes. Thank you. We have two proposals for us today, or two groups of proposals. I do know that UAMS has called in on Zoom. I did see them. We also have the Department of Health here, Dr. Smith, and I have the Department of Health on the agenda first. So, Dr. Smith, if you would like to go ahead and tell us about your proposals. I guess before I turn it over to you, I'll let everyone know that Department of Finance and Administration has reviewed these proposals as our process requires that they go through a review at CFNA, and you should have received an approval document from them, a recommendation from Department of Finance and Administration, and Secretary Walter can answer questions about that if you have any. So, Secretary Smith, Nate Smith from the Department of Health.
Yes, here I am. I'm really tiny. Thank you, Secretary Smith.
Oh, thank you. This will make you big. Hang on.
I'm not sure it will. It may just make me a big green orb there with a phone in it. Anyhow, let me. I'll try and act bigger than I am on the screen. This proposal is really actually many parts all lumped together in one. We've got 7 sections. 3 of them are more substantial than the others. I'm going to go through each of the parts briefly and then open it up for questions. And I invite as detailed a question as you have. The first section is actually misnamed, and I apologize for that. It says PPE, or personal protective equipment. In the budget, though, it's actually mostly ambulance coordination, and the PPE part is to support the Battelle PPE decontamination unit. And those costs, which are a smaller part of this, actually should be 75% reimbursed by FEMA. The second part, which is one of the 3 really substantial parts, has to do with laboratory testing and supplies. And there's a lot of parts there. We basically have 3 platforms that are supported through this grant, and then all the things that are needed to support a high volume of testing. The first platform is a high throughput machine within the Arkansas Department of Health Public Health Laboratory that is produced by a company called PerkinElmer. And that should be up and operational next week. And that can do 700 tests for COVID-19 at a time. And will greatly enhance our capacity. And we basically budgeted enough to do over 300,000 tests on that platform over the next 6 months. We have a second platform called BioFire that is not a high volume, but it gives results much more quickly. And we have the instrument already in place. This is just for the reagents for it. There are some situations where we need rapid results, and that's where that would fit in. We of course have we'll continue at some level the current platform that we're using that is very labor intensive and relatively low volume. The other large section is basically to utilize high throughput machines at other facilities. We've had, and this is the last item, Panther Reimbursement. We have had very productive talks with Children's Hospital. They have one of these instruments. It's also a high throughput instrument, and our plan would be to utilize their capacity or one of the other 4 Panther instruments in the state to do an additional 330,000 tests over the next 6 months. So that's that section. I'm going to move on to the next really substantial section, which is contact tracing. And this is basically to scale up what we're doing now, get the right people in with the right training, the right equipment. And this is really critical for us to get back more towards normal, to restore our economy, rapidly identifying those who have been exposed to COVID-19, get them quarantined, get them tested, and in addition to the personnel just to do the calls, collect the data, there's a critical need to take those data points and convert them into actionable information. So we also have some positions in there for data analysis for informatics. And that's a pretty detailed budget and plan in there, but I won't get too far down in the weeds on that. The next section in the sheet is a smaller one. It's IT equipment, hardware and software. This is basically a hodgepodge of things that support contact tracing, that support our lab testing, support communications, as well as security for all these activities. The next section is the quarantine facility, and again, 75% of this should be reimbursable by FEMA. This is for the facility that we have to safely house those in quarantine or isolation who don't have safe housing. And that's we haven't had to use that a lot, but when we have needed it, we've really needed it. And then the next section is another large section that is in here, although we're not asking for the funds at this time. This is looking ahead to COVID-19 vaccine administration. And this is to give you all an idea of, to the best of our knowledge, what we think it's going to take if we get this vaccine to actually get it out to people in our state. And this is really based on what we know, because we do vaccinations continuously, and every year we do large-scale influenza vaccinations. We have experience from the H1N1 pandemic influenza, and so we basically are able to cost this out pretty accurately. But of course, there's a lot of unknowns about this. Will we have a vaccine? When will we have a vaccine? Will it be 1 dose or will it be a 2 dose? How much of this will be supplied by our federal partners? how much will we get and over what period of time. There's a lot of unknowns, but what we have in here is just kind of a placeholder. And then the last is miscellaneous. This again is a sundry critical items, but they don't neatly fit in any of the other categories. I'm going to go ahead and pause there and ask if there are any additional questions, areas where people would like some more detail, especially on the budget. I have Chief of Staff Stephanie Williams here to go down into detail in the budget side.
Secretary Smith, or Dr. Smith, this is Secretary Smith, and I had a question regarding the 75% related to the quarantine facility. Is the $923,000 that you have listed the remainder, or do you expect to request this and then get reimbursed later? Do you understand what I'm asking?
Go ahead, Stephanie.
Yes, ma'am. Secretary Smith, this is an estimate for a 12-month operation of that facility. The facility, as Dr. Smith indicated, is up and is operational now. We have completed the necessary paperwork that's required by FEMA to be certified to seek reimbursement for the facility. They have a set of standards. We've met the standards. We've actually received the approval letter back, I think, 2 weeks ago. So we do know that at the end of this event, we will be eligible to seek reimbursement for utilization of that facility.
The challenge, of course, with FEMA is that it can take a really long time to get those funds, and so that's why it's in here as a request.
Dr. Smith, this is Larry Walther. One question that I have, or one concern I have, is the time frame for the expenditure of the CARES Act ends on December the 30th of 2020. We're supposed to have we're supposed to have made the expenditure by that date.
So, Secretary Walther, we went ahead and presented this budget because we honestly don't know about, the utilization of that facility. As Dr. Smith said, to this point, it's been used sporadically. However, if we should find ourselves in a situation where we have a significant outbreak in a homeless population or a homeless shelter, we could need that facility, and the stated occupancy is 28, but we actually could go in and do some modification of the facility to almost double the capacity.
Secretary Walther, is your concern that since we put this in for 12 months of operation and we have to have these funds expensed by the end of this calendar year, that maybe we should scale this back to just the remaining months in this calendar year?
No, I'm not. I just want you to understand that is a requirement at this point in time. And as we get closer to the end of the year, we may need to reallocate that money, but if you can't spend it by that time, and it's still not permissible.
Yes, sir. We understand that, and we appreciate that.
Okay. I just want to make note of that.
Thank you. Does anyone else have any other questions? Oh, I think Secretary Walther has another.
Yeah, let me make one comment. We were talking about one specific part of it. If there's another part within the proposal that same concept is true, then it will hold true for both of them or all of them.
True. Where that definitely could be the case is with the immunization part, because no one really knows when we will have vaccine available to us. I've been on some calls where if everything goes well, there could be vaccine being pushed out, at least on a semi-investigational basis, to states, to high priority populations as early as this fall. And if we were able to do that, incorporate it into our fall influenza vaccination program, then there would be some some economies of scale there we'd want to take advantage of. If it doesn't come until spring of next year, obviously, it would have to come from a different pot of money, and we would have to stand that up separately from our influenza vaccination efforts.
Okay. Thank you.
Thank you. And that part is not being requested at this time, right?
Correct.
Thank you.
I have a question real quick. Can I ask my question? Can you hear me? I see you shaking your head. Okay.
Secretary Smith is muted. Secretary Smith, you're still muted.
That's fine. Yes, please go ahead, Senator Irvin.
Okay, thank you. And it may relate back to what Secretary Walter said. So, so the two areas, if I'm correct, that we could get 75% reimbursed from FEMA would be the quarantine facility, and I think you said the PPE category, but which is actually the ambulance coordination and the PPE for the Battelle system that's at the Goodwill Industries for the N95 masks. Are those the two areas? Is that correct, Secretary Smith?
That's correct.
And so my question is, so if we go ahead and spend this money, but then we get the FEMA reimbursement, and that money then comes back to us and it goes back into this CARES money, if it's beyond the December deadline of this calendar year, just because of, you said FEMA takes a little bit longer to get us money or to reimburse us. I'm just wondering how that would work in relation to what Secretary Walther just talked about, quote, spending the money. And so what does spend mean? That's the second part of my question too, is number one, is there the time frame on that money if FEMA reimburses us and it comes back to us? And then the second part is, can we allocate this money into like a reserve account, and is that technically spending the money? Does that make sense?
I think, yes, I understand your question. Secretary Walther might be able to comment on that. Presumably this FEMA reimbursement will come back well after the end of this calendar year, and that my understanding is that money comes back to the state rather than to a particular fund. But Secretary Walther, can you comment on that?
Yeah, I guess my view would be that if we spent the money and received the goods in that year, or that just because we got reimbursed from FEMA next year would be irrelevant. The idea, that's the way I would view it right now.
Okay, thank you.
Secretary Smith, I have a question.
Go ahead, Secretary Gillespie, please.
Thank you. Secretary Smith, on the contact tracing, this sort of follows along the same line. It notes in there that it's an 18-month period, but it also talks about hiring staff and a management company. Are the staff through the management company, or are y'all anticipating that you would be bringing on the management company who would bring on the staff, and thus everything would be spent this year with the management company, hiring them to do this for 18 months, or how is that part expected to work?
So, go ahead. So, Secretary Gillespie, we actually are approaching the contact tracing as three different projects moving in parallel. The retention of a management company to hire staff that we would then expect them to scale up and scale down depending on the situation as it evolves. Also hiring some additional staff here at the department to ensure that we have adequate capacity, and then also utilization of volunteers. And so it's all three of those combined. Does that help? Or did I answer your question?
It does. So most of this, what you've described, therefore, you would be able to spend before the end of this year because it's
Yes.
through the management company.
Yes.
Okay, got it.
Secretary Smith, I just have a comment. I want to go on record officially to recuse from the vote when this proposal comes up due to a family member that works for a diagnostic testing company.
Yeah. Secretary Smith, did you hear Secretary Fetcher's comment about recusing herself?
We heard the beginning, but if you wouldn't mind, Secretary Fetcher, please repeat I did hear you wanted to recuse from the vote, so we will allow you to recuse, and I think that's really all we need. If anybody else has.
It had to do with one of the lab items, family member associated with that. So.
Okay. Thank you.
Yeah.
I appreciate that. I'll make note of that, Secretary Fetcher. Thank you very much. And I did have another question, Dr. Smith, about, you mentioned ambulance coordination when you were going through the proposal in the beginning, and I just want to make sure that I know where that
is under PPE. So, and actually that's most of the funding that is under that PPE category. And I could explain to you why that ended up getting labeled PPE instead of ambulance coordination, but it would not be worth your time. But in terms of that contract, Chief of Staff Stephanie Williams is very knowledgeable about that, so I'd let her give you a summary of what that is.
I guess the question that I would have is, the ambulance coordination, is that $360,694, and that there's not a request for PPE?
No,
in this right here, but there was a separate. Well, yeah, go ahead and explain, because I'm lost.
Yeah, of the $360,694 in that category, $293,194 are for the ambulance coordination contract. The balance of that, which is about less than $70,000, those are things to support the Battelle PPE decontamination unit. The actual PPE, the cost of purchasing the PPE is been submitted through another funding source. So it says PPE, but this is really for the Battelle system to decontaminate PPE.
Thank you very much. And your budget attachment A does set that out very clearly, and I just had hidden that piece of paper here on this desk with all of my papers. Thank you. I appreciate it. Does anybody else have any other questions yes, Representative Allen here in our room.
Secretary Smith, at the bottom of page 1, you are requesting $30 million and $30,504,000 for equipment. And you mentioned that there was a piece of machinery that could do 3,000 tests over a period of 6 months. So if you look at it over a period of a year, that piece of machinery will do 600,000 tests in 1 year. Is that correct?
That is true. And we also have budgeted for a similar amount through the Panther instrument, one of which is at Children's Hospital. So the idea here is, currently our goal for this month is to test 2% of our population, which is 60,000 tests. Really, the goal that we should be striving for, that has been recommended and will be our target for June, will be 1% per week. So that's doubling. So that's 120,000. That's why we need to have that capacity to do, over 600,000 tests in a 6-month period. What we have here is the capacity to do 312,000 on the Perkin-Elmer instrument in the public health laboratory, another 30,000 through the BioFire platform at the Public Health Laboratory, and 330,000 on the Panther platform at Children's or some combination of these 5 sites around the state that have that instrument. So that would not quite give us 720,000, but it gets us close. Of course, we've got contributions from UAMS and the commercial labs as well.
One quick question. What about the accuracy of the machine?
For these high throughput lab-based machines, these have the highest sensitivity and highest specificity. Where you start getting into problems with sensitivity and specificity are with these point-of-care machines like the Abbott ID Now. Those are a little harder to control in terms of the conditions, and that's where there have been problems with false negatives. But with these lab-based machines, high throughput instruments, they're very, very accurate. The challenge, of course, is that you got to collect some specimen, ship it to the lab, and then get the results back. If we have these high throughput machines, though, then we can have a rapid turnaround, get those results back in less than 24 hours.
So you all have the personnel to operate this machine, or will they have to come in and do an in-service?
Well, for the Perkin-Elmer machine, we're training those staff right now. That we should be ready to roll with that next week. For the Panther, this is an instrument that's, for example, at Children's Hospital, they're doing the same thing. They expect to be up and running within at least a week or two.
Okay. Thank you, Dr. Smith.
Are there any other questions? Oh, yes, Representative Gray.
Thank you. This is probably for Secretary Walter, but I'm back to the contract tracing. So a couple of questions here. The first section is on what we're looking at costs with management contracts. So two-part question. The first part is, in order to essentially expend those funds by December 31st, will we need to actually expense that out and pay that contract by December 31st, or just having it encumbered in a contract count? And then the second question is, this management and info staff, no management contract, those are all 12-month positions, and trying to figure out exactly how we could encumber that by the end of the year and it qualify for this CARES Act money. I don't know if that's for Secretary Walter or Dr. Smith.
The information we have from Treasury basically says if the government has not used funds it has received to cover costs that were incurred by December the 30th, 2020, as required by statute, those funds must be returned to the Treasury. Generally speaking, I had a side conversation with Paul Lothian a few minutes ago. When we're doing making expenditures in the state, and we cannot cross a fiscal year. In other words, we can't pay for something in 2020 that we're going to actually receive in 2021 fiscal year. If that concept applies, which we think it does, but the way everything we've seen, then we need to not only spend the money, but receive the good in 2020, calendar year 2020. Having said that, things can change as we move closer to that date, and the Treasury possibly could make some different rulings so that it gives us a little latitude in making those expenditures, but they haven't so far. That's not the direction we've been given by Treasury.
Stephanie, do you have a plan, what we're going to do at the end of the year, or how we're going to be able to expense these for salaries and things of that sort that have to go on further than that?
So our understanding is that any of the funding that we don't utilize, we will return to the CARES Act funding for reallocation through the CARES Committee. So we asked for everything we thought we needed to get started. We realized that with contact tracing and some of these other things, we may find ourselves in a situation that we have to ramp up and ask to add additional staff beyond the 300 or so that we've asked for here. In a lot of the estimates that have been done for contact tracing, they've estimated that we're going to need many more people. So we're aiming at what we think is reasonable, but our understanding is anything that's unspent, the committee would have an opportunity to reallocate that at the end of the calendar year if it's unspent.
Now, what Secretary Walther is saying, though, is that they can't expense it after December 31st, so it doesn't help them to get the money back because they can't use it. They got to return it to the federal government.
If it's after that date, if we could have a time prior to that where we realize that we can't spend the money in that time period, that we can return the money. I'm under my understanding is that there are some places we can use that money, like in the unemployment insurance trust fund. I've heard, and several legislators and others have told me that we could actually put funds in the trust fund. And so I assume we would, at the end of the year, to the extent we had additional money, we could help shore up the trust fund because it's being depleted, every month right now because of the unemployment.
Yeah, and that, if I could, I'd like to make a suggestion maybe, because I agree that we need, this is a great proposal, but I'd like to look at it maybe end of September, 1st of October, and just get a feel with Dr. Smith about where we're at and the funding. And that way, if it looks like there's going to be additional money, get it sent back so we could reallocate it in enough time. Because like Dr. Smith said, if we don't get it back until the end of the year, it's too late to reallocate it.
So we would go ahead and, Representative Gray, we would go ahead and approve it today, but then have a review of it in September. I think that's a great idea.
Okay. Good idea. Thank you.
I like that. Go ahead.
We could also put together a version of this that does not include anything, salaries or anything like that, that would be after December, and then we'll also look for other federal funds potentially to continue those beyond that period of time.
I think I would be okay either approving this and just having you do a review in September to see where you think we'll be at the end of the year. It would either be that or have you go back and recalculate. Instead of the total cost for the total program for 12 to 18 months, I would need just the cost of the program for the next 7 months. So I guess it's whichever the committee's comfortable doing.
I think that if we went forward, because you're going to be needing the funds here and now to get started with the program, to go ahead and receive the contract in order to perform the contact tracing, then I think I don't think we would have a problem if the committee would like to go ahead and approve the motion and then have a review. We could do that, and I think that's probably a good idea to do with a lot of the funds that we're looking at, is to review those towards the end. Okay. Thank you. Thank you. Did you have something?
No, I'm good.
I had a question.
Go ahead, Senator Bond.
So I was excited to see the testing and the contract tracing. The issues that we've had over testing supplies and having the swabs and things to do the testing, have those been resolved? Are we to the point where we're going to be able to do this robust testing without having supply chain issues?
This is Dr. Smith. I'm reluctant to make any definitive statements about the future, but as of now, the collection kits are not a problem. We have been promised 90,000 for this month from our federal partners, and at least as much the following month. In addition, we've purchased a large number ourselves, something like 250,000. So we should be good for that, and the supply chain issues are becoming less. We'll certainly be good for the next 3 months on this, and that gives us 3 months to procure another similar supply.
All right, I think, at least I think I've heard you say, in fact, that it will build confidence out there with more testing. And I'm a big proponent of that. And then you said we'd get the 24-hour turnaround, which has been another issue. Waiting 3 or 4 days for results creates more problems. On the contact tracing, did I miss, how many employees is in that 22 million? How many folks are we going to need? That may have been in the materials and I just missed it.
What we have is, what we budgeted for are 350 contact tracers, and then also counting on another 85 volunteers. Now, it may exceed that because we've actually already received promises of more than that, but then we're going to need people to adequately supervise those individuals so that their activities are coordinated. One of the things about contact tracing and why it's difficult to scale it up quickly is because it's a highly integrated, highly coordinated activity. And if you've got people doing stuff that's not done in a coordinated fashion, it's not all that helpful. We also have in there positions to help us to get the information systems in place so we can take those data points, do rapid analyses, and then target our efforts at preventing the spread of COVID-19 based on the information we're getting in real time.
Right now, how many contact tracers do we have? And is that the ones we have now included in the 350 number?
No, we right now have about 200, but many of them are people who are, we've pulled them from other programs. They don't necessarily have the job skills or the motivation to do this work. We do have a core of basically 3 groups. One was our outbreak response team, mostly nurses with some epidemiologists, and we need to use them for the other things because it's hard to imagine, but in addition to COVID-19, we still have hepatitis A, we still have, these other outbreaks, and we'll have influenza in the fall, et cetera. So we need to get that core back to managing these other outbreaks. We have another core of disease intervention specialists we've pulled over, and their normal job is to do follow-up for HIV and syphilis and other sexually transmitted infections. And as we know, we have increasing incidence of those, so we need to get those folks back to doing that important work as well. And the third group are folks who've been pulled from all sorts of things, and they need to go back to doing their jobs as well.
So, and that's what I was getting at. I don't know that it makes much difference, the budget request, but so this is 350 new people, not including the numbers we've been using now. We have 200, but we're going to have 350 new people?
That's correct.
All right, thank you.
Are there any other questions for Dr. Smith?
If there aren't any, Madam Chairman, I would make a motion that we accept Dr. Smith's recommendation.
I'll make a second.
Okay, we also had a second from Dr. Bledsoe here in the room. Thank you. Is there any discussion on this motion, or have y'all? I think a lot of questions have been answered. If there's any discussion, I'll be. Go ahead, yes.
Can you hear me? The only thing I would say is just that I think Dr. Smith and the health department have done a great job of putting this all together. We're not going to get a handle on this problem unless we get out in front of it. And the contact tracing and the lab ability is how we do that. And so I really appreciate the health department digging in on this. And I think this is a great allocation of the funds going forward.
Thank you. Would there be any way that we could say we approve it with the review to be performed, just so that way it's kind of in the motion? Yeah. So I'd be the motion amended. So Secretary Walther.
I will amend my motion to include the review. I will amend my motion to include the review in September.
Thank you.
Good.
Thank you. And I believe Dr. Bledsoe is seconding that.
September.
Any other discussion on the motion as amended? I don't hear any requests for other discussion or questions. So, and I can't see, oh, now I can see everyone. Let me just make sure that if there's anyone that has any discussion,
or any issues related to the motion? Okay, then I will call for a vote. I know that Secretary Smith has recused, and now I do hear someone trying to speak, but I can't tell who that is.
I vote aye.
Oh. All those in favor?
I think we ought to vote.
Do it again. Yes, all those in favor?
Aye.
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 All opposed? No, the ayes have it, and we had one abstain. Thank you very much. Your motion has passed. And we will move on to the UAMS proposal. And I did provide the committee with the bios for Drs. Patterson and Gardner. I saw them they did call in through Zoom, so I think, Jeremy, there they are. I see them waving. Hello. Hello. Thank you. So I appreciate our Chancellor, Dr. Patterson, and Stephanie Gardner. Dr. Gardner, our Provost from UAMS. I'll turn the mic over to you. Please tell us about your request, and we're so glad to have you. I hope you can hear all of us clearly. Have you had any trouble with that?
No, I can hear all of you, including the birds that are flying around Senator Urban.
I know. She's got a better place than we all do.
Secretary Smith.
I'm literally on the side of the road. Sorry about that.
Off the road. Yes, Dr. Patterson.
Yeah, Secretary Smith and Dr. Bledsoe, members of the committee, we appreciate the opportunity to present this proposal to you. I'll make some general remarks, and then Provost Gardner will tell you about the proposal. This proposal was put together at the request of the governor in order to help us to understand the prevalence of previous COVID-19 infections across the state. This proposal is based on antibody testing. The testing that has been done so far in the state, as you are aware, has primarily been PCR testing, looking at the presence of active infection. Antibody tests will tell us the prevalence of previous exposure. We know now that over 90% of patients who are infected with COVID-19 develop antibodies. We are beginning to understand that the presence of these antibodies may confer protection against reinfection. We don't yet know how long antibodies remain positive and for how long protection against infection is conferred. However, as we begin to think about going back to having our students in schools and their communities, having mass gatherings, it's going to become critical for you as policymakers to understand how many people have previously been infected by COVID-19 in communities. And also, we need to work to expand the capacity to do antibody testing within the state. So with that as a predicate, a team that includes the Department of Health, the Arkansas Department of Health, Arkansas Children's Hospital, and UAMS have put together a plan to develop high-quality antibody testing, to use this testing to assay for the presence of previous COVID-19 infection in our state, over testing for minority populations, including Latinos, African Americans, and Marshallese, and dramatically expanding our capacity to do COVID-19 antibody testing within the state. That team did diligent work and created the proposal that you have in front of you, which I will ask Dr. Gardner to give a brief summary of.
Thank you, Chancellor Patterson. I think he's done a great job of framing what this proposal is all about. There are really two main priorities for the proposal. First is to develop and assess the analytic specificity and sensitivity of a newly developed lab-derived test at UAMS for COVID-19 antibodies.
The second goal is to estimate the prevalence, as he mentioned, of COVID-19 antibodies among Arkansans. So we've divided it into 3 phases, and the first phase of the study is to focus on our development of a COVID antibody test. We have been working on this for the last few months, actually, and components of an assay were gifted to us from Dr. Kramer at Mount Sinai. We have been able to duplicate that test in the lab. We do not yet have emergency EUA, emergency use authorization, but predict that we will not have difficulty receiving that. With the test that we have developed, we believe that we will have, as the Kramer test, 98.5% specificity. And so believe it'll be very reliable. But we are also ramping up in our clinical laboratory for the Beckman test, which will, once validated, we're waiting this week on the reagent. We believe it'll be in by the end of the week. We'll validate also a clinical test with the Beckman assay. And therefore, we will have the ability to look at our samples, comparing one assay to the other to ensure that we're getting reliable results. The second part of the proposal is to do seroprevalence study. And we propose doing that in 3 successive waves. The first wave would be June through July. The second wave would be in August and September. And the third wave would be October and November. During each wave of the seroprevalence study, we would be collecting 1,500 adult samples, phase 1, and 3,000 in wave 2 and wave 3. In addition to those tests among adults 18 years of age and older, we would also be looking at 300 pediatric samples in the first wave and 600 in the second and third waves. The pediatric samples, unlike the adult samples where we're doing random calling and trying to make sure that we have a very representative sample of the entire state, pediatric samples, we made the decision to use waste samples so that we're not collecting blood in children unless it is already being collected. Our epidemiologists believe they can get a very good estimate of what's happening among the pediatric population using that methodology. The third phase that we describe in the proposal is acquiring a robotic assisted immunoassay machine that will allow us with the UAMS lab-derived test to have production in high numbers. And so we believe that by early fall, we can run 2,000 samples a day on our machine with the lab-derived test, the Kramer test. But in addition to that, our laboratory, our clinical pathology laboratory with the Beckman test is also going to be prepared to run 1,500 to 2,000 samples a day at minimum. So this fall, in addition to having the completion of the seroprevalence studies by end of November, we should also have the capacity to do widespread testing for the state. With that, I'll conclude, but entertain any questions.
Thank you so much. This is amazing, and I really appreciate you bringing forward the proposal. I appreciate y'all's hard work and all the work that you guys are doing there at UAMS, and I appreciate Department of Health and Children's working with you because this is amazing. It's very exciting to see that there's a possibility here in Arkansas and for you to have brought this to us. So yes, does anyone have any questions?
I just have one question.
Yes, Dr. Bledsoe.
This is for Dr. Patterson. Just one quick question. This isn't in partnership with anything with Now Diagnostics in Springdale, Arkansas, is it? Or this is completely?
This is not. We're aware of what they're doing, and we certainly would entertain anyone who wants to piggyback on the sampling that we're doing. There's nothing that would preclude that from happening, but we're only asking for funding for the serosurveillance study and expanding statewide capacity right now.
That's great. The only reason I ask is because I've got a distant possible tie with Now Diagnostics, and I just wanted to recuse myself if there was any sort of connection. But if there's not, that's fine.
Yeah,
Thank you.
There is none.
Thank you. Does anyone else have any questions?
I just
Anyone here in
want
the
to ask one
room?
question.
Yes, Representative Allen.
Hi, Dr. Patterson. I appreciate what you're doing. I just have a question about the robotic process. Could you briefly tell me how the robotic process will function?
Yeah, so Dr. Gardner is more intimately aware of that, so I'll ask her to respond on behalf of UAMS.
We currently have the lab derived tests. We're running results every day, but the number is about 100 a day today. When we get the robotic arm assisted machine, we'll be able to run thousands of samples because they automatically are pipetting rather than human work doing each sample by hand. It's a machine that allows us to do high throughput processing.
Got it. Thank you.
So exciting.
Okay, but
Yes, Representative Gray here has a question. Hold on just one second, Senator Irvin.
Yep.
Go ahead.
Thank you. Just a quick question, and this may just be my lack of knowledge, but will this test, will it be able to determine the antibodies for the COVID-19 specifically, or just any of the coronavirus strains in general?
No, this is a specific assay for COVID-19. So these are antibodies that target the spikes that are unique to COVID-19 among the different species of coronavirus.
Thank you.
Thank you. And I believe Senator Irvin has a question.
Yes, just a quick question. Will, as far as, I may have missed it in here, but collection of samples, will that be statewide, and then all the lab testing will be done at the UAMS campus in Little Rock?
That's correct. So the way that the way that this study will work is that we will use our technology to use knowledge about phone numbers to predict where people within the state live. We'll identify people across the state, and then we will send our staff to them anywhere in the state to collect samples, or they can go to a local community center if we have one in that area and have their sample collected. If they don't want to have somebody come into their home, then those samples are brought back to our Little Rock campus where the assays will be run.
Okay, and what's the time frame on collecting the sample and then to the results?
So we'll have the ability to have the results within 24 hours, but the intent of this will not be to share the results with the individual. So the results will be shared back to the individuals in aggregate form, but an individual will not be waiting on their own specific results.
Now, that's different than if there is a clinically indicated test. If your doctor says you need to have the test, we will have the capacity, as Dr. Gardner mentioned, to run 4,000 to 5,000 assays a day for clinically indicated tests. And obviously, those tests get turned around within 24 hours and reported back to the physician and the patient.
Great. But again, I think it's an excellent proposal, and really just appreciate the level of detail and that you put into this. So happy to make a motion to accept your proposal at the proper time.
Thank you.
Thank you. Is there any other questions, or do we have a second on the motion? I think Representative Allen, thank you. So we have a second on the motion. Is there any discussion or any additional information anyone needs? I appreciate the information that you've provided today. I don't think we have any. Trying to make sure I give everybody an opportunity to ask a question or have discussion. Okay, well, I'll call for the vote. Thank you. All those in favor, please signify by saying aye.
Aye.
Thank you. Anyone opposed? Thank you. Dr. Patterson, Dr. Gardner, the committee has voted to approve and recommend your proposal. We really appreciate the time that you've spent with us today. I'm sorry that Governor Hutchinson wasn't here. to have the opportunity to hear from you as well. But I'm sure he knows all about this. So thank you very much. And I believe someone else is trying to speak. Yes, go ahead.
I just wanted to make a clarification on the first request from the Department of Health. Excuse me. The request is for $58,018,704. It does not include the $29,600, $29,600,000 for the vaccine administration program.
That is correct.
Thank you. I just want to make sure everybody knew that.
Thank you. I believe that was clear. Thank you. Yes, that was what I understood the motion to be. Thank you. Does anyone have any other business for the or issues for the committee?
Nope. Chairman Smith.
Yes.
This is Representative Lane Jean.
Hello.
I'm doing good. How are you doing?
Go ahead. We're good. Go ahead.
What have we, after what we did today, what have we allocated as a total?
I think.
Okay, DFNA, did you do a quick calculation of that yet? Because I have not added it up. I'm sorry.
How much it is?
We don't have that calculated, but we will get it out to you.
We will be submitting a report to the General Assembly on Friday.
I can, hang on just a second, and I'll tell you, I think that where we are approximately, we were at, I think, 350 million, and we've added, so we're about, what is that, getting close to 400, a little over 400 million, I think is what we've allocated. But we'll get an accurate number from DFNA.
Elizabeth, I'll get that to you quickly, and then you can get it out to the steering committee.
I appreciate that. I will do that. We are working. I wanted to make sure that everybody noticed that we do have all of the information posted online. It will be on that link. We will be working on the website. Hopefully next week we might have something different, but at least we will have the information posted that we receive on Mondays. We will get it posted by Tuesday so that the public has the opportunity for public comment. Anything else for the good of the order?
Chairman Smith.
Yes.
This is Lane again. Looking at the fall, when they say, some of the experts say this stuff may come back even with more impact than it has now. And this is something I talked to Larry Walters about. What do we need to hold in a reserve? And I guess the experts need to tell us for when October or November gets here, because I've just gotten word from some of the county people that they've been told to start looking at this CARES Act for the county and city funding. If that starts to happening, we're going to have requests coming out of the walls. And we're trying to figure out what do we need to be holding back to be safe for the public good when November gets here and there's a big wave of infection. And I don't want a number now, but I think we need to be looking at it and seeing how much money we need to be holding back with the best guess of the experts, Dr. Smith, and of course I think Larry would be the one that needs to put this together, financial guy at DFNA. But just some discussion on that and some thought. And if anybody's got some thought or if Larry's got some idea of what we need to be holding back, I'd like to hear it.
Yes, Representative Jean, that number has been in discussion, or the topic has been up for discussion a number of times, I believe. Obviously, Dr. Smith is looking at that on a daily basis as to where we are currently and where we need to be. And I know they're working on trying to get us those figures because that is very important. So maybe what we can do is see if we can get an idea of maybe when we will be able to know, or maybe have a good discussion for the committee with that information. Would that be okay, Dr. Smith and Secretary Walther?
Yes, it would. And obviously, we're still buying PPE right now, and hopefully we'll have enough on hand that it will last for some time. And that may not be something we'll need to be doing toward the end of the year, but there are other things obviously that would come up if we did have another outbreak that from the medical side that we'd need to address. And so I agree 100% that we need to keep some amount in reserve.
This is Dr. Smith. I agree as well. We're looking at that, keep looking at that carefully. And with regard to the PPE, with this Battelle decontamination unit or system as well, that allows us to extend the life of that PPE. It can be the masks, the N95 masks, which are what are in shortest supply. They can be decontaminated and reused up to 20 times.
That's great. Thank you.
Chairman Smith, just a quick question. Yeah. So I appreciate what Representative Jean, what his questions were, and I agree as far as just strategic, budgeting purposes and really cracking down and figuring out what might need to be in reserve and how we can spend that money. I think is really important. But just wanted to clarify that will these appropriations will need to go, I guess, before Legislative Council, or is that planned for next Wednesday? Is that correct?
Yeah,
DFNA.
Yes, that is correct. We're prepared to take the Department of Health to ALC on Wednesday. We also have, I don't think we have anything from the department, from UAMS. So only the Department of Health will be going over. And we're prepared to do that.
Okay, so, all right. So you're just gonna, okay. Thank you.
And with that, we typically plan for our next meetings to be on Wednesday afternoons. And there was an indication that with the ALC meeting on Wednesday morning at 9:30, that we may be requesting to be called for a meeting on Tuesday if we need to have anything brought before ALC. And I can't promise you one way or the other, but I thought I would go ahead and mention that in the event that we need to meet on Tuesday. Is that going to be a trouble for anyone?
Just a question. Would you then have to post something on Sunday, or how would that work? I guess.
And, this is Larry Walther. I would hope to make a decision by Friday to let everyone know. We would expect to have the request, know what those requests are at least by Friday, so we can notify everyone that we would need to have the Steers Committee meeting on Tuesday evening instead of Wednesday. And that way we don't delay the appropriations if necessary by a month, by expediting them next week, I mean.
And I would agree that I will provide the proposals to the committee on Sunday. I've realized that Monday is Memorial Day, so you may not want to be looking at them on Monday, but I'll provide them as soon as we can, maybe even earlier than Sunday if possible. And then you have a question about UAMS.
Yeah, why is it?
UAMS is not needing to go forward to ALC related to this request. Is that what you, Secretary Walther, you said?
That is correct.
Okay. So, they have somewhere in their budget. Is there anything else for anyone? We stand adjourned. Thank you.
Thank y'all. Thanks for putting up with the